Ange, are you ready for your presentation?
Yes, I am. Thanks,
Good.
Mel.
I wasn't sure if you could hear us. Take it
Yes,
away.
I
Thank you.
can. No worries. Thanks, Mel. Hi, everyone. Thanks for coming on to the virtual forum and joining me today. Just a quick introduction. My name is Ange. I'm a nurse manager working at Fiona, Stanley and Fremantle Hospital Group. I have joined Fiona Stanley since the day when Fiona Stanley opened in 2015. I have experience in medical and surgical wards, hyperbaric medicine, did a bit of nursing research, and now I am working with the nursing corporate. So my role is managing our graduate recruitment for both Fiona Stanley and Fremantle Hospital. So Fiona Stanley and Fremantle Hospital are under South Metro Health Services, and our vision is to deliver excellent healthcare every time. We will be an organization that values and sustainability, engage with all staff, and demonstrates high performance across all of our areas. Our values are including integrity, care, respect, excellence, and teamwork. So what is transition to practice? So for our grad program or transition to practice, we have tailored programs for our first year registered nurses, enrolled nurses, registered midwives, and South Metro Health Services mental health program. So similar to Rockingham Hospital. Our program structure is we are placing all our grads in two sites between Fiona Stanley and Fremantle Hospital. It is a 12-month program, and graduates will be working part-time at 64 hours a fortnight. There will be two 6-month placements, and then we provide graduate-specific orientation, supernumerary days, lots and lots of support network, education, and at the end of the completion, all the graduates will have graduate completion certificate, and then we also throw an afternoon tea party. So for study days and professional developments, all of our graduates are entitled to 5 study days. 2 of them will be a mandatory graduate study days, and then it will be run by our graduate program coordinator. And then the 3 study days will be choose your own study days. Our organization has numerous study days, and you could also opt to follow and work with our specialty CNS or CNC. So for example, if you are a grad that are working on the surgical ward, you could do a wound or vascular study day, as well as do a supernumerary shift with the specialist nurse of the day. There is also a graduate forum with different topics every month that you could attend. And then this also could be used as a networking experience between all the graduates and the clinical educator with one another. So our program requirements. All of our graduates are contracted to 64 hours a fortnight. You are able to pick up extra shift as well as you wish, but we also offer graduates to do less hours and work at a minimum of 48 hours per fortnight for 12 months, inclusive of leave. So it will be a 6 shift in a fortnight, a minimum. Graduates, the reason why we have like a minimum hours for our graduates is to allow graduates to have work-life balance. So our graduates are required to complete the 2 mandatory study days, complete the performance development review with the nurse unit manager at 1 month and at 11 months, complete their essential framework, chapter 2, and they have to participate in all the graduate forums and tutorial where possible. So this is just the program outlines that will be run by our graduate coordinators. So the first one is to basically set your goals and objectives for the 1 year grad program. The second one is you need to complete the chapter 2 of our competency framework and then consolidate it on the workplace. The third phase is you have to complete the area-specific core skills, and then our grad coordinator will touch base with you after 7 months, after first month, and after 7 months. All of these are we use MSAT to monitor the progress. Is continuing your professional development, where graduates are expected to participate in study days, forum, in-service, and self-reflection. So we had a couple of questions about like our specialties and our areas for Fiona, Stanley, and Fremantle during the breakout session. So here are the list of areas that we are offering for our graduates. So we have multiple specialties for the transition to practice program. Fiona Stanley Hospital itself takes graduates on the state rehabilitations, mental health, cardiology and medical specialties, trauma and musculoskeletal, acute care medical, and acute care surgical. So in total, we have 30 wards and areas for Fiona Stanley Hospital, and that's including ward settings and outpatient settings. For Fremantle Hospital, we do take graduates on the medical, surgical, rehabilitations, and mental health, and we have around 16 wards and areas, both on the general ward as well as outpatient areas. So I'm going to talk about the South Metro Health Services Mental Health Program. So it is similar with the program that runs by Rockingham. So we basically offer a 12 months contract, and then graduates will have to choose between doing the mental health program in Rockingham or Fiona Stanley and Fremantle Hospital Group. So the graduate certificate will be with University of Notre Dame, Australia, where the 2 units will be paid by SMARTS, and then the graduates will have to pay 2 units with the scholarship. So it is a discounted rate. So you will basically do 2 weeks of intensive course at the beginning of the grad program. And then at the end of our 12 months grad program or uni, you will get your post-grad qualification. And then in the future, you could also complete a further study for graduate diploma or Master of Nursing in Mental Health. So it is a good opportunity if you are actually interested in working in mental health. So we also offer registered midwife program. So all of our midwife graduates, they will be allocated on all of these areas, including the obstetric wards, birthing suite, prenatal clinics, and MAFAO, which is our maternal fetal assessment unit. And they will also be offered 6 study days within a year during the first year of grad program. So you will be doing antenatal study day, fetal surveillance program, neonatal resuscitation program, prompt, intrapartum, and newborn skills. Our graduate supports. As I mentioned before, we do offer lots and lots of graduate support. we understand that this is the first time you come to our workforce as a nurse and midwife. So we do offer number of support. So these are the following people that will be available during your 12 months program. The first being nursing corporate, so me, myself, and my colleague Aaron Webb. And then we do have the program coordinators or the graduate coordinators. So basically, they are the one who manage your education or study days when you are doing your 12 months grad program. So we have Alison Slater down in Fiona Stanley Hospital, and then we have Natalie in Fremantle Hospital. We do also have like our nursing unit manager on the ward and the midwifery manager to support you on day-to-day basis, as well as the clinical nurse educator or the staff development nurses. All of our graduates will be allocated with preceptors during their program. And then over the weekend or after hours, we also have graduate coaches who is a senior clinical nurse, and then they will be able to help and assist all of our graduates on the first 2 months of the rotation. So what happened after you complete the transition to practice? So similar with Rockingham, we also offering a re-employment process. So after 8 months in, the graduates can apply to all specialties within our two sites, Fremantle Hospital and Fiona Stanley. So we do offer more specialized areas, including critical areas like emergency department, theater, ICU, and PACU. We also offer acute care areas, aged care, and state rehab. So all of the successful applicants will be offered a fixed term contract or permanency at the end of the graduate program. For those who didn't secure a contract, we will also support them through the hospital permanent pool or casual pool. So at the moment, our rate for re-employment is 1%. So most of our grads, I can probably say they retain to within our organization. Normally, the one who didn't get the offer, mostly because they left the organization or they do have performance issue, but this is very rare. And slide. So we also do offer professional development beyond the graduate year. These are just a few of them. So the first, the top two on the list is the Explorer and Odyssey. So the Explorer is catered towards the second year grad for them who are working in the acute care areas. While the Odyssey is a transition for registered nurse who are wanting to work in the critical care areas, like I said, the emergency department and ICU, CCU. The next professional development is also a discovery, where we support our clinical nurse or clinical midwife to transition from registered nurse to become a clinical midwife and clinical nurse. And then we also have a self-paced learning modules that is catered for our advanced practice nurse as well as manager. If you have any queries about Fiona Stanley and Fremantle Hospital Group grad program, you could email us at this email address, fsfhg.nursingrecruit@health.wa.gov.au, or you could call me directly on 6152-1618. And yes, so that's the end of my presentation. And we would like for you to join our organization and then be part of our family. Thank you.
Thanks so much, Ange. And thank you, Kate. We've got some time for questions. If anyone, there was a question in here. Sorry, is Ange still there?
Coming back up now.
Thanks, Marty.
Yes, Mel, I'm back.
That's okay. There was just a couple of questions in the chat. Do you offer a graduate certificate in nursing or clinic nursing for those in a non-mental health stream during the transition to practice new grad year?
Okay. So for the first year grads, we only offer the South Metro Health Services Mental Health Program. But on our second year, we do have grad certificate with other university as well, like ECU, Murdoch, and Curtin University. So you could apply to our second year reemployment, and then you could join our Explorer program, as well as enrolling to university for your grad certificate in acute care, and then it will be scholarship as well. You could apply for scholarship. We do offer that service.
Thanks. And someone else was asking if you offer a grad program in pediatrics.
Fiona, Stanley, for first year, we do offer pediatrics. For neonates ward, we take grads on the second year.
Thank you. And then the last question was, do they get a preference between Fiona Stanley or Fremantle? Okay.
So we had a couple of questions like this as well during the breakout session. So basically, if you are, if you put your preference to Fiona Stanley Hospital and Fremantle Hospital as your first preference, and then if you are selected and shortlisted for our graduate program, before we invite you to the interview, we will also sending you preference form, and then all of the lists of the areas of specialty will be sent out to you, and then you can list down all your preferences. The way we allocate our graduate nurses are based on how well you answer your selection criteria, and then how well you perform during the interview. Yes, so my suggestion earlier to all of like the grads that came to our breakout session, practice from now, go and then make connection with your clinical facilitator, go and talk to your body nurse, go and practice with your like student colleague as well, how to perform like interview, and then ask your lecturer, your clinical facilitator to check on your selection criteria.
Thanks, Ange. That's some really good advice there. It's so important preparation is key in the graduation application process. So thanks again to Ange and Kate for your time in presenting your graduate programs this afternoon.